Hello, today we'll be talking about Chapter 20, Neoplasms and Cancer. The cell is the functional structural unit in the body. Every cell has an outer plasma membrane, and that encloses the fluid cytoplasma or intracellular fluid. The membrane is semi-permeable, so it controls passage of certain materials in and out of that cell. The plasma membrane includes special protein molecules or receptors for substances like hormones, chemical transmitters, or drugs. All these affect the function of the cell. The nucleus of the cell has the DNA. This is the genetic material that controls the particular cell's function and structure and the nucleolus. The nucleus is enclosed by the nuclear membrane. The cytoplasm contains various nutrients like proteins, glucose, and electrolytes that are all required for metabolism of the cell. Additional substances present depending on the cell's function. For example, glycogen is found in liver cells or lipids are found in fat cells. Other structures located in the cytoplasm include the rough endoplasmic reticulum. This is responsible for protein synthesis and for export. The free ribosomes, which is responsible for protein synthesis for cell maintenance and repair. The mitochondria, which provides necessary energy in the form of adenosine triphosphate for cell activity, or ATP. The Golgi complex apparatus, this helps modify and package the proteins so that we can export them from the cell. And then the lysosomes that contain the digestive enzymes for the breakdown of unwanted materials within the cell. And just in case I didn't say it clearly, the rough endoplasmic reticulum is responsible for protein synthesis for export. So really, what is cellular structure and function? Cellular structure is what makes up a cell. The cells are made up of organelles and cytoplasm. They're all bound together by this membrane, and the function of the cell is to be the smallest building block that makes up living things. Why is the cell structure important? It's important because when we understand the function of a cell, each structure within a cell has an important function, and that helps the overall mechanics of the cells. Cells are made of organelles, each with its own specialized role. What are the four cellular structures? Four cellular structures could be four organelles. The main organelles of a cell include the nucleus, which organizes and stores information in the form of DNA, the cytoplasm that holds all the organelles, the mitochondria, and the mitochondria produces the energy that we need in the cell, and the cell membrane, which holds the cell together. Cells vary in their degree of development depending on the differentiation or specialization required for that particular cell's function. For example, neurons and cardiac muscle cells are highly developed, whereas fibroblasts are less so. Normally, cells are organized in an orderly arrangement in a tissue and differentiated to fulfill that tissue's function. When cells become disorganized or undifferentiated, or if their growth becomes uncontrolled, the specialized functions are lost. Mitosis is the process of cell division that produces two genetically identical daughter cells from a single parent cell. This form of cell division functions in growth, tissue repair, asexual production in some organisms. Mitosis is part of the cell cycle. Regulator genes control mitosis for different types of cells. Growth factors such as cytokines signal proliferation or promote growth, whereas inhibitors inside cells prevent excessive growth. During its lifespan, each cell will follow the basic cell cycle of growth and reproduction or mitosis. Genetic control over growth and reproduction is exerted through DNA, and the daughter cells are identical to the parent cell. If the DNA is altered in the parent cell, the mutation is passed on to the daughter cells. Different cells experience different lifespans. For example, Erythrocytes live for about 120 days, but some leukocytes only survive a few days. Highly specialized cells, like neurons, cannot undergo mitosis, but they have a very long lifespan. Some types of cells can increase their reproductive rate on demand. For example, bone injury increases osteoblast activity. Cell reproduction always requires adequate blood supply to the area, sufficient quantities of essential nutrients such as those amino acids, glucose, and oxygen. Cellular aging occurs naturally over time and results in altered cell structure, decreased cell function, and in time, cell death. Certain cells will undergo a programmed cell death known as apoptosis. Really, oncology is the study of cancer and it includes diagnosis, treatment, and prevention. A neoplasm or a tumor is a cellular growth that no longer responds to normal body controls. The cells will continue to reproduce even when there is no need for them. Excessive growth will deprive the other cells of nutrients. Many neoplasms are not able to function as normal tissue cells because they have atypical or immature cells. The characteristics of each tumor will depend on the specific type of cell from which the tumor arises or originates, resulting in a unique appearance and growth pattern. The expanding mass will create pressure on the surrounding structures. Pressure is never good because eventually that is going to lead to impairment, destruction. Tumors are named according to root words, such as chondro. Chondro is the cell of the origin, in this case, cartilage. Depending on the type of tissue in which the tumor is located, the suffix would indicate malignant tumors. Carcinoma for epithelial tissue, sarcoma for connective tissue. The suffix oma alone indicates benign tumor, as in lipoma or fatty tissue. A number of neoplastic disorders have acquired unique names that are recognized in medical practice. Examples include Hodgkin's disease, Wilms tumor, and leukemia. This slide goes over the various names. I would just review these. Fatty tissue is lip, and then benign is oma. So lipoma would be benign tumor of fatty tissue. Gland tissue is adeno, and malignant epithelial tissue is carcinoma. So, adenocarcinoma would be a malignant tumor of epithelial lining of a gland. And then fibrous tissue is fibro. The malignant connective tissue is sarcoma. So, fibrosarcoma would be malignant tissue or a malignant tumor of fibrous tissue. Benign tumors usually consist of differentiated cells that reproduce at a higher rate than normal. The benign tumor is often encapsulated and expands, but it doesn't spread. It is able to move freely when you palpate it. Tissue damage results from compression of the adjacent structures, such as the blood vessels. It's not considered life threatening unless it's in an area such as the brain, where the compression of itself can be life threatening from the compressing on those surrounding tissues and causing increased cranial pressure, things like that. Malignant tumor are Malignant tumors are usually made up of undifferentiated, non-functional cells that do not appear organized. The cells will reproduce more rapidly than normal and often show abnormal mitotic figures. These cells have lost cellular connections with each other. Reproduction is not inhibited in the presence of other similar cells. These cells will vary in size and shape. Tumor cells will infiltrate or spread into surrounding tissue and can easily metastasize or break away to spread to other organs and tissues. So look at the differences here with the characteristics of the benign versus the malignant tumors. So in a benign tumor, the cells are going to kind of look normal. They're differentiated and the mitosis process is normal. In a malignant tumor, the cells will vary in shape and size. They'll have a large nuclei. They're undifferentiated. The mitosis will increase and it's atypical. Growth for a benign tumor is going to be slow, but it will be expanding mass and it's usually encapsulated. The malignant tumor will be rapid growth. The cells are not adhesive, so they infiltrate other tissue. There's no capsule here. Not adhesive means that the cells don't stick together. They remain kind of loose and they're easily able to break away. For benign tumors, they would usually be in a local area, so they're going to cause more of a local problem. And with malignant tumors, they can invade nearby tissue or metastasize to different sites through the blood and the lymph system. And then for as far as life-threatening, benign tumors are usually only life-threatening when they're in certain locations, like the brain, and of course that would be due to the increased pressure, not the tumor itself. With the malignant tumor, it can be life-threatening because it will destroy tissue and it will spread. Again, this is just another chart from your book, and I would know the chart. Just look at it. It's the same chart we just discussed, and it's just showing you the differences between the benign versus the malignant tumor. Malignant tumors are usually made of undifferentiated, non-functional cells that do not appear organized. The cell will reproduce more rapidly than normal and show abnormal mitotic figures. These cells have lost cellular connections with each other, and reproduction is not inhibited in the presence of other cells. Tumor cells can infiltrate or spread into the surrounding tissue, easily metastasize, break away, and spread to other organs or tissues. The tumor will manifest as an enlarging space occupying mass composed of primitive or dysplastic cells. It lacks the growth inhibition, the controls, and the cell to cell communication. The expanding mass will compress the nearby blood vessels, causing necrosis, inflammation around the tumor, increasing pressure on the surrounding structure. Malignant cells don't stick to each other or adhere to each other, so they can break loose from the mass and infiltrate the adjacent tissues. These tumor cells often secrete enzymes like collagenase, which can break down the protein or the cells, adding to the destruction and promoting the tumor spread into the adjacent tissue. Inflammation and the loss of normal cells leads to a progressive reduction in the function of the organ. As the tumor enlarges, the inner cells are frequently deprived of blood and nutrients and will die. This necrosis can lead to more inflammation and infection at the site. Some cancer cells will secrete growth factors that stimulate angiogenesis, the development of new capillaries in the tumor, promoting tumor development. Some neoplasms develop very rapidly, and others may remain in situ for a long time. In situ refers to neoplastic cells in a pre-invasive stage of cancer that may persist for months or years. So, in other words, this tumor sits where it starts and it just stays there. This is good for like determining cervix cancer because it helps us look at these cells. Grading of the tumors is based on the degree of differentiation in of the malignant cells. A grade 1 tumor has well differentiated cells similar to the original cells, whereas a grade 4 tumor, the cells would be undifferentiated, varying in size and shape, known as anaplasia. This type of tumor is considered highly malignant and is likely to progress quickly. Warning signs of cancer that people should be familiar with and that you should be familiar with at the nurse are unusual bleeding or discharge anywhere in the body, a change in bowel or bladder habits, such as prolonged diarrhea or discomfort, a change in a wart or mole, especially in the color, the size, or the shape, a sore that doesn't heal quickly on the mouth, in the skin, anywhere, unexplained weight loss, anemia, low hemoglobin, and persistent fatigue, persistent cough or hoarseness without reason, a solid lump, often painless, in the breast or testes or anywhere in the body. Pain is not usually an early symptom of cancer. It usually occurs when the tumor is well advanced. Pain is a warning of a problem, so it is helpful if it occurs early, but it's usually rare that it does. The severity of the pain will depend on the type of tumor and its location. Pain can be caused by direct pressure of the mass on the sensory nerves, especially where the space is restricted, as in bone cancer. Dull, aching pain results from stretching of a visceral capsule, such as what occurs in the kidney or the liver. Inflammation can also contribute to pain because of increased pressure on the nerves and irritation of the nerve endings by chemical mediators. Secondary causes of pain include infection, ischemia, and bleeding. Blood can be irritating to the tissues, and if it collects in an area, it can also cause pressure on the nerves. Obstruction can also occur if a tumor compresses a duct or a passageway. Obstruction may occur in ducts or tubes in the body, such as those in the digestive tract. The blood supply or lymphatic flow may also be restricted, leading to ulceration and edema. So this is just showing you different types of obstruction. So we can have obstruction from the mass itself, obstructing the colon, in the lungs. The tumor can block the airflow into the bronchus. So the pain and stuff, that was some of the local effects, obstruction. Now we're going to talk some of the systemic effects and the tissue destruction. So now we're going to talk about some of these systemic effects. So systemic effects would include things like weight loss and cachexia. Now cachexia is severe tissue wasting, and that can occur with several different types of malignancies. Contributing factors would include anorexia, fatigue, pain, stress, any increased demands on the body by reproducing tumor cells, nutrient trapping, altered carbohydrate and protein metabolism, and cachetic factors produced by macrophages in response to the tumor. This in turn leads to added fatigue, weakness, and tissue breakdown. Anemia or decreased hemoglobin is a common problem resulting from anorexia and decreased food intake, chronic bleeding with iron loss, or bone marrow depression. Anemia Anemia will decrease the amount of oxygen that is available to the cells, leading to fatigue and poor tissue regeneration. Severe fatigue can be caused by inflammatory changes, cachexia, anemia, stress, treatment schedules, psychological factors, especially those that a person feels when they're facing a life threatening illness. This can also lead to fatigue and depression. Exudative effusions are a response to inflammation, sometimes from a tumor, and that can increase the capillary permeability, allowing fluids that contain protein and white blood cells to leak into the pleural cavity. Infections such as pneumonia occur frequently because the resistance by the host is going to go down here. The tissue breakdown will develop and the immune system becomes less effective. The host immobility will contribute to the infection in the lungs because the secretions are static and not moving, and the client has a weaker cough effort. Bleeding can occur because the tumor cells may erode the blood vessels or cause tissue ulceration. Bone marrow depression and hypoproteinemia may contribute to poor clotting. Chronic bleeding is common in the digestive tract where the mucosa fails to regenerate quickly. Chronic blood loss leads to iron deficiency anemia. Paraneoplastic syndromes are additional problems associated with certain tumors. So, this is when a person has signs and symptoms that are really being caused by that specific tumor, such as bronchogenic carcinoma in the lungs. Tumor cells will release substances that affect the neurological function or blood clotting or that have hormonal effects. For example, the cells of a bronchogenic carcinoma may produce adrenocorticotropic hormone, leading to manifestations of things like Cushing's syndrome in the client. So there is some routine screening if we have early detection following treatment to detect any tumors, self exams, early detection if done consistently. We can detect things like breast cancer, testicular cancer, and even we can look at our skin and see when there are things on there that need to be reported, like changes in the color of the skin, uh, moles that change, warts that change. Also, there are blood tests that we can look at that measure cell levels during treatments, and they can look at things like tumor markers, such as the PSA test. We can also use x rays, MRIs, CT scans. These are ways that we look at the way that the tissues are changing. We can also look at organs to see if there's any kind of damage done. Cytological tests, these use a biopsy or a cell sample. And so this may be the most dependable confirmation of malignancy that we have. The histological and the cytological exams help determine the degree of differentiation and the tumor type. And we also may test for growth promoter sensitivities, such as estrogen dependent tumors here. Genomic tumor assessment would identify different genetic mutations that are independent of heredity but only occur with the disease itself. And then we also have tumor markers that we can look at. These are substances, enzymes, antigens, or hormones that are produced by certain neoplastic cells. These tumor cell markers can be used to screen high risk people, confirm diagnoses, or monitor the course of a certain malignancy. Examples include carcinoembryonic antigen for colon cancer, human chorionic gonadotropin for testicular cancer, alpha fetoprotein for hepatocellular cancer, CA125 for ovarian cancer, and prostate specific antigen for prostate cancer. Many of these substances are present with other diseases, so the presence doesn't necessarily mean that the person has a positive diagnosis of cancer. Tumors spread by one or more methods depending on the characteristics of the specific tumor cells. They can produce secondary tumors that consist of cells identical to the primary or parent tumor. Many cancers spread before the diagnosis, and we must consider this factor before treatment begins. There are three basic ways for the spread of the cancer to occur. Invasion refers to a local spread, where the tumor cells grow into the adjacent tissue and destroy the normal cells. The tumor cells are loosely attached to other cells and can secrete lytic enzymes to break down the tissue. The origin of the word cancer is Latin, meaning crab-like, a good image of an invasive tumor. Metastasis means spread to distant sites through blood or lymphatic channels. In this case, the tumor cell will erode into a vein or lymphatic vessel and travel through the body. Frequently, the first metastasis appears in the regional lymph nodes. These then localize the tumor cells for a time. The lymph nodes are checked at the time of surgery, and often several are removed. The lymph nodes are removed or treated to eradicate any micrometastasis that may be missed, especially in cancers known to spread at an early age. Many cancers spread through the normal venous or lymphatic flow, and therefore the lungs and the liver are common secondary sites for many tumors. Some cancers are more selective and spread to unusual sites. Seeding is the spread of cancer cells in body fluids along the membranes, usually in body cavities. The tumor cells break away and travel easily with movement of fluid and tissue. An example is ovarian cancer, in which the large peritoneal membrane encourages dispersion of the tumor cells throughout the entire peritoneal cavity. Malignant cells may also be dislodged from the tumor if excessive handling occurs during a diagnostic procedure or surgery, causing further spread. So if we look here at the invasive carcinoma of the cervix, we see the carcinoma in situ, where it's non-invasive. The cervix invasive carcinoma is in the diagram on number 2, and then the vaginal involvement on slide number 3. And then if we look at slide number 4, it shows the widespread invasion there. This next slide is just showing how metastatic breast cancer occurs. So first we have the primary tumor, and then you see the lymphatic vessel and the vein there. The tumor is going to spread towards that lymph node. Then it's going to go into the cells and into that lymphatic duct, into the vein system. The tumors will lodge into the capillary beds. Then the tumor starts to grow and spread. So now we have this secondary tumor here that's growing and spreading. It gets to the lungs, where we now have multiple tumors. All right. And if we look over here now on the side, where it went into the vein in part number 3, it's now follow the lymphatic system to the vena cava. It can spread to the axillary nodes or the axillary lymph nodes, and a lot of those are going to be up in that talus fence that we talked about in that upper outer region of the breast. The person develops that primary breast cancer. It can now metastasize to the lungs, to the brain, to the liver, to the ovaries, and the aorta is where this blood is going to carry the tumor cells from the lungs out to all the organisms. So it's metastasized to the lungs first. So you see there on number 4, and from there it's going to go out to all those other areas. 5 through the aorta, and then the 6s are to the ovaries, the liver, and the brain. And then this slide is showing us how ovarian cancer spreads through the pelvic and the peritoneal cavity. First, we have the primary ovarian tumor, and then we have that continuous peritoneal membrane. It spreads all throughout there, and then develops that secondary tumor at the site of the liver. So remember, the secondary tumor is going to be identical to the parent or the primary tumor. So for staging cancer, we have a standardized system that we use, and it helps us estimate the prognosis of the cancer and determine how to treat it. The most common system used is the TMN system, and it measures T, the size of the primary tumor it looks at, N, the involvement of the regional lymph nodes, and then M, the spread of metastasis of the tumor itself. Other systems may be used for specific cancers, but all are based on the same principles. Staging of cancer is a classification process applied to a specific malignant tumor at the time of diagnosis. The staging system describes the extent of disease at the time and helps provide a basis for treatment and prognosis. So again, staging systems are based on the size of the primary tumor, which is T, the extent of the involvement of the regional lymph nodes, which is N, and spread or invasion of metastasis of the tumor, which is M. Just review this chart. This chart kind of gives you an idea of how they stage it. With stage 1, you look that there's a tumor. It's less than 2 centimeters in diameter. So that's your T. For the N, or the involvement of the lymph nodes, we have no lymph node involvement here, and for M, no metastasis. And then if we go all the way down to stage 4, we have a tumor any size. It's fixed to the chest wall or the skin. There's clavicular node involvement, and metastasis is present. So each one has a different degree there that we're measuring. Carcinogenesis is the process by which normal cells are transformed into cancer cells. Malignant tumors will develop from a sequence of changes over a pretty long period of time. A combination of factors or repeated exposures to a single risk factor can cause changes that activate or change the gene expression, leading to transformation of the normal cell into a malignant cell. Some specific cancers have well-established risk factors, such as bronchiogenic carcinoma or lung cancer and cigarette smoking. The multiplicity of developmental steps in carcinogenesis is supported by the fact that not all cigarette smokers develop cancer. It's difficult to establish precise predisposing or causative etiological factors for each cancer because it takes so many years to gather sufficient documentation, and frequently multiple factors are involved. There are a few stages involved in carcinogenesis. The initiating factors, or the procarcinogens, will cause the first irreversible changes in the cell's DNA. Genetic changes or exposure to environmental risk factors may cause the first mutation. The initial change does not create an active neoplasm. Then we have exposure to promoters later that cause further damages in the DNA and changes. This results in less differentiation and an increased rate of mitosis. Dysplasia or anaplasia may be evident at this time. This process can lead to development of the tumor. We have continued exposure and changes in the DNA, and eventually this results in a malignant tumor that is capable of growing and invading the local tissue. Once changes in the regulation of growth result in the cells that are capable of detaching from the tumor, it can then spread to distant sites, known as metastasis. Knowing the speed with which tumor cells reproduce and spread, it's important in making treatment decisions. Tumors that metastasize readily and exhibit cells that produce quickly are described as aggressive. So we look here at the multi-stage carcinogenesis in this photo. You'll see that first you have this initiation process, which is going to cause the irreversible mutation of the DNA. And this is going to be from repeated exposure to things like the sun, specific viruses, cigarette smoking. So we have this repeated exposure to carcinogens, And then next, we'll have a little bit later, we'll have these promoters. These are going to be additional changes in the DNA and the cell structure. And this can come from things like hormones, food additives, industrial factors. So, again, additional risk factors. And eventually we end up with cancer. Now we have this cell, okay, and the cell is starting to change, or it's created a mutation. So it's become this mutant cell. And we have growth from that mutant cell. From the initiation, we have proliferation of the initiated cells. The membrane will start to change. All right, the body may do immune surveillance here and destruction of the mutant cell if it detects it. Now, not everybody's body will detect those mutant cells, and eventually you can end up with this malignant cell. Some risk factors, such as food, can be avoided. Other factors, such as genetic predisposition, cannot be avoided, but can be addressed by encouraging things like frequent screenings and early diagnosis. Genetic factors, oncogenes that regulate all growth, breast cancer, people with high family incidences, retinoblastoma, inherited leukemia, and chromosome abnormalities. For viruses, risk factors are oncogenic viruses that alter the host cell DNA, such as hepatitis viruses that cause hepatic cancer, HPV or herpes simplex virus 2 that cause cervical cancer, Kaposi's sarcoma that develops in someone with AIDS or late stages of HIV. Other factors that can put us at risk are things like radiation, ultraviolet rays from the sun, X rays, gamma rays, any radioactive chemicals that can cause cumulative chromosomal damage in the cells. This can be things like sun exposure, which cause skin cancer, and radiation exposure that lead to leukemia. Exposure to both natural and synthetic products or chemicals in excess can also be hazardous. The effects of carcinogenic agents can depend on the amount of and the duration of exposure, such as asbestos, which can lead to lung cancer, nickel, which can lead to lung cancer, solvents like benzene, which can lead to leukemia, aniline dyes, and rubbers, which can cause bladder cancer. Also, biological factors, chronic irritation and inflammation with increased mitosis. So, things like ulcerative colitis can lead to oral cancer. Leukoplakia can lead to ulcerative colitis can lead to colon cancer, and leukoplakia can lead to oral cancer. Also, with age, many cancers are more common in the older person. That surveillance system, that immunity system is not working quite as well anymore. And then our diet, okay, natural substances, additives, processing methods. Then look at things like high fat diets, which can cause colon cancer, smoked foods, which can cause gastric cancer, hormones, which can, like estrogen, which can cause endometrial cancers. So, how can we reduce our risk factors? Limit our exposure to any sort of UV rays, those either from the sun or tanning booths. Get regular medical and dental exams. Do self exams of the breast and the testicles. In the diet, increase fiber, reduce fats, eat at least 5 to 10 servings of fresh fruits and vegetables daily. These foods have antioxidants, which help reduce the changes in the DNA. Cell mediated immunity recognizes some tumor cells and will destroy them. We do have immunizations for cervical cancer and hepatitis, and it is recommended to reduce the risk of cancer from certain infections. Treatment will depend on the specific cancer, surgery, chemo, immunotherapy, radiation, or a combination of the above. The effectiveness of treatment will also depend on the stage of the cancer, the type, and the health of the client. Many treatments will result in long term remission and some in cure. Palliative treatments to reduce pain in late stage cancers is commonly done. Treatment may be curative if the tumor is small and localized, palliative if the cancer is advanced. Palliative treatment is intended to reduce manifestations or complications related to the cancer and to prolong life, so to help the client feel a little bit more comfortable. For example, decreasing the size of a tumor may lessen the pressure on a nerve, relieving pain, or reducing pressure on the esophagus or the bronchi. Not all cancer cells are sensitive to radiation or chemo. Hematopoietic cancers such as leukemia are treated by chemo because the cancer cells are dispersed in the blood. Solid tumors are frequently removed by surgery, which is then followed by chemo or by radiation or both, if the tumor cells are sensitive to these therapies. Immunotherapy can stimulate the client's immune response to target the cancer cell and attack it. Surgery involves the removal of a tumor and the surrounding tissue, including the nearby lymph nodes if required. The surgical approach can involve the use of laparoscopic and several incisions. This approach minimizes tissue damage and improves the recovery time. In some cases, removal of adequate surrounding tissue may result in considerable impact on the function, for example, in the brain or with skeletal muscle damage. Sometimes complete removal of the tumor may be impossible, but reducing the size of the mass may prevent complications and alleviate some symptoms. Radiation may be used alone for some lymphomas or combined with other therapies to treat radiosensitive tumors. Radiotherapy can cause mutations or alterations in the targeted DNA, preventing mitosis or causing immediate cell death. Radiation can also damage blood vessels, cutting off the blood supply to the tumor cells and starving them. Radiation is the most effective on cells that are undergoing DNA synthesis or mitosis because it destroys the more rapidly dividing cells in the body, both tumor cells and normal cells. Some types of cancer are radioresistant or unresponsive to radiation. Radiation can be used before surgery to shrink a tumor or destroy loose surface cells, or it may begin after healing of the surgical site. It may be used as an adjuvant therapy prior to surgery to help shrink the tumor. External sources, such as a cobalt machine, help deliver radiation for short periods to a certain site in the body. No radiation remains in the body after treatment. Internal insertion of radioactive materials at the tumor site may be used to treat specific cancers, such as cervical or oral tumors. This is accomplished by sealing the radioisotope in a seed or a needle and implanting the device at the site. Therapy known as brachytherapy. Brachytherapy is now being used to treat breast cancer in early stages when radioactive material is implanted in the surrounding tissue after removing the tumor. Another method is to instill a radioisotope in a solution in a body cavity, such as the pleural cavity, to control excess inflammatory exudate or blood from the tumor. These clients have to be monitored to make sure there is no leakage or loss of radioactive materials. For certain cancers, radioisotopes may be given orally. Radioactive iodine is given for thyroid cancer because iodine goes directly to the thyroid gland. Precautions are required when clients have internal sources of radiation to minimize radiation exposure to other people. Adverse effects of radiation depend on the dose and the extent of penetration of the radiation in the body. Normal cells that rapidly reproduce, such as those in the skin and the epithelial cells or the mucosa, the bone marrow, and the gonads, are damaged by radiation as well. Bone marrow depression is the most serious negative effect. Blood cell counts are constantly monitored. Decreased leukocytes greatly increase the risk for infection. Decreased platelets can cause excessive bleeding, and decreased erythrocytes or red blood cells will contribute to fatigue and tissue breakdown. Pneumonia and septicemia are common life-threatening complications because body defenses are reduced. May have slow or they may have to slow or stop the treatment here. Epithelial damage includes damage to the blood vessels, vasculitis, and skin. Skin becomes inflamed, as in a sunburn, and hair loss, called alopecia, starts to occur. The mucosa of the digestive tract is also damaged, resulting in nausea, vomiting, diarrhea, and the risk of malnutrition and dehydration. Inflammation and ulceration in the digestive tract may lead to bleeding, as indicated by melena or hematemesis. So that's this blood in the stool or blood in the vomit. With the head or neck radiation, the oral mucosa may become ulcerated, and xerostoma, known as dry mouth, may develop. Swelling can impair the food intake, swallowing, and ventilation. Abdominal radiation is likely to damage the ovaries or the testes, leading to sterility or the risk of teratogenesis. Sperm banking or egg retrieval and storage should be considered and discussed with the client before starting treatment. In addition, radiation can produce nonspecific fatigue and lethargy accompanied by mental depression. Long-term effects of radiation include inflammation, necrosis, scar tissue along the pathway of the radiation and at the tumor site. Scar tissue may cause adhesions or obstructions and other secondary problems. Some types of cancer cells respond well to certain anti-neoplastic drugs, where other types of cells are resistant to this therapy. Chemo may be used alone, as in leukemias, or combined with surgery or radiation. Drugs are most effective against the most rapidly reproducing cells and on small tumor masses. This is a list of some of the drugs that they use. Classifications include antimitotics, antimetabolites, alkylating agents, antibiotics, and these drugs will interfere with the protein synthesis or the DNA replication. So usually when we look at chemo drugs, they're usually going to affect somewhere in the cell cycle. Now, this course doesn't really focus in on drugs, but I'm just giving you a brief synopsis of what would occur here. Unfortunately, this slide doesn't show the picture that's in your book, but if you look in your book, you will find this picture of cell cycle and chemotherapy. The drugs will interfere with the protein synthesis, the DNA regulation, replication at different points in the tumor cell cycle, and destroy the cells. A cell cycle is usually a mini cycle of growth and reproduction. Now, along with the good comes the bad. Here, we'll have some adverse effects from that chemotherapy. So, bone marrow depression is the limiting factor with chemo, and we can have sometimes dangerously low blood counts that require the client to receive transfusions or require us to stop the therapy until the bone marrow is able to recover. The nadir, this is the lowest cell count of neutropenia or leukopenia, and it can occur at different points in the cycle depending on the particular drug. So this is when your white blood cell count is really at its lowest. All right, and the treatment may have to be postponed, and antibiotics or hospitalization may be required because here your client is at a really high risk for infection. They'll also probably be on reverse contact isolation here. Hemorrhage is a major risk with thrombocytopenia. Infections are common with neutropenia, septicemia with tumors in the GI tract, and pneumonia with lung cancers. Skin infections are common, especially if mobility or malnutrition has led to some sort of skin breakdown. Vomiting can occur during or shortly after treatment because of direct chemical stimulation by the drug of the emetic or vomiting center in the brain. Vomiting can occur after treatment in response to mucosal inflammation and damage in the digestive tract. And in some cases, nausea and vomiting will actually develop before the chemo is given, related to things like anxiety or past experiences. Also, smells, seeing certain sights, things like that can induce this. Antiemetic drugs can be helpful to decrease the vomiting. Epithelial cells are easily damaged because of the ongoing mitosis. So hair loss, known as alopecia, and breakdown of the skin and mucosa can occur frequently. Stomatitis in the mouth and diarrhea are also common problems and can contribute to malnutrition. Candidal or yeast infections are common in the mouth. In addition, some anti-neoplastic drugs can have damaging effects in certain areas. Like in the lungs, it can cause fibrosis or it can damage your myocardial or your heart cells. Hormones are often prescribed during cancer treatment in addition to basic treatment. Glucocorticoids, such as prednisone, are used to help decrease mitosis and increase the erythrocyte or the red blood cell counts. These drugs can also help with things like nausea and vomiting. These drugs and inflammation. These drugs improve appetite and a sense of well being. They can decrease inflammation and swelling around the tumor. Sex hormones can help when the tumor growth is dependent on these hormones. For example, estrogens may slow the growth of prostate cancer. Hormone blocking agents are often effective in reducing tumors and preventing reoccurrences. Tamoxifen is an example of an estrogen blocking agent, and this is used in clients with estrogen dependent breast cancer. It has been especially useful in postmenopausal women. Biological responders, biologic response modifiers are agents that can help the natural immune system respond better to improve surveillance and remove abnormal cells. And included in this group are a natural product of human cells called interferon and BCG, which is the vaccine for tuberculosis. The BCV the BCG vaccine can be injected near the tumor or put into a cavity such as the bladder when the cancer is present, and it can stimulate the movement of macrophages and T lymphocytes to the site where they would destroy the tumor cell. Other than BCG for treatment of bladder cancer, these are not first-line treatments at this time. Identifying and acting on molecular targets, perhaps in the immune response, is seen as a way of developing new drugs with fewer side effects. So they have some new drugs that are coming out. They won't cure the cancer, but they're supposedly going to help with the negative effects of the cancer. They would help people to live longer, along with some palliative care. And there are still ongoing studies to determine the effectiveness of these drugs. And just to Gene therapy is experimental cancer treatment, and it helps replace mutated genes with a healthy copy of the gene. It can inactivate a mutated gene, or it can introduce a new gene. Patients with advanced cancer are often malnourished. Contributing factors include changes in taste sensations, anorexia, vomiting, sore mouth or loss of teeth, pain, fatigue, malabsorption because of inflammation in the digestive tract, altered metabolism, and nutrient trapping by the tumor. These factors can result from the tumor itself or from effects of chemotherapy and radiation. Pain control, antiemetic drugs can help with the appetite, and if necessary, TPN may also be used. Total parental nutrition. It would involve administration of a nutrient mixture directly into a peripheral vein. Complementary therapies are also used. Many alternative approaches are used to treat or cure cancer. These non-medical therapies are referred to as complementary, and they range from use of raw food, a macrobiotic diet, to use of insulin and glucose to accompany the chemo. Patients can choose complementary therapies, but they should advise their oncology team that they are doing so. It's important that the healthcare worker is aware of any complementary therapies, and then they can direct patients to the appropriate information for this type of treatment. A cure for cancer is generally defined as a 5-year survival rate without recurrence after diagnosis and treatment. In some cases, several periods of remission where no clinical signs occur may happen before the disease becomes terminal. So the patient may be in this cancer-free state if they've been 5 years clean without any remissions. Some cancers, again, like that leukemia, should be considered cure after 10 years free. And then remission is no signs of cancer. Skin cancer is visible, easily diagnosed, and treated by surgery. It develops slowly, so most types, with the exception of malignant melanoma, will have an excellent prognosis. Skin cancers have the highest rate of recurrence and usually originate or arise on the head and the neck or the back, areas exposed to the sun and irritation. Basal cell carcinoma is the most common form of skin cancer. The tumor appears as a pearly papule and develops a central ulceration or a rodent ulcer. Significant characteristics of the lesion include lack of pain or itching and persistent. The lesion remains and slowly grows. The tumor is slowly invasive to subcutaneous tissue. Ovarian cancer is a very prognosis, and it ranks high in mortality. The tumor is hidden in the peritoneal cavity, and it's known as a silent tumor of this reproductive system. Hormonal and genetic factors appear to play a role in the development of this cancer. Presenting signs are vague and appear only after the tumor is well advanced and is large enough to put pressure on the adjacent structures, such as the bladder or the intestines, or when some inflammatory exudate forms in the abdominal cavity. The first indications are usually alterations in bowel or bladder function or an increase in the abdominal girth. The tumor spreads easily through the lymphatic vessels by seeding as cancer cells pass along the peritoneal membranes or are sloughed into the peritoneal fluid, traveling to the liver and other organs. The cancer also invades the uterus and the pelvis. Brain tumors may be benign or malignant. They are both space occupying masses that create pressure inside the skull and are serious for this reason. Brain tumors, even when small, can cause death if they are located in the brain stem or the cerebellum, where they can interfere with vital functions such as respirations. Basal cell carcinoma, you'll see a picture of this in your book. It's figure 20.11. Basal cell carcinoma is the most common form of skin cancer. The tumor appears as that pearly papule and develops a central ulceration. You can see it here in that, if you look in your book in that picture um, on figure 2011. Significant characteristics of the lesion include lack of pain or pruritus and persistent, and this grows slowly. I apologize that the pictures aren't appearing here on the slide. I'm not sure why, but this is brain tumors that can occur in various locations. And again, this is in your book. Brain tumors vary histologically, originating from neurons or neuroglial cells in blood vessels or connective tissues. They can happen in kids and adults. Early indications of a brain tumor would be seizures, pressure such as a headache, drowsiness, vomiting, visual problems, or impaired motor function. Malignant brain tumors do not metastasize outside of the central nervous system because the primary tumor is usually fatal before the metastasis begins. However, tumors from the breast, lung, or bone can metastasize into the brain and form secondary tumors. The most common cancers in men are prostate cancer. Remember that loves to metastate to the bone, lung cancer, and colorectal cancer. And then the most common cancers in women are breast cancer, lung cancer, and colorectal cancer. This concludes this recording.